Close it now.
Hey, this is Richard Zombeck, and you're listening to Buds with Suds. You can check us out on iTunes, Google, Spotify, YouTube, and Stitcher. And if you are on iTunes, please rate us. It does help us out. Also, if you'd like to leave us a message, voicemail, so to speak, you can call us at 978-219-9554. Leave a suggestion, a question, a comment. Maybe we'll play it on a podcast. And you can also subscribe to the podcast, not only on all of the outlets that I mentioned previously, but you can also go to budswithsuds.com and click on the link for our mailing list. So in this episode, I talked with Jessica, a.k.a. Jess Mulvey. She is a recovery coach at Lynn Community Health. And she also, it's kind of interesting the way I met her. I was speaking at Michelle Simon's class at North Shore Community College, and Jess was one of the students. And about a week later, she sent me this monstrosity of a research report on sober houses and rooming houses and sober living, and she did a tremendous amount of research about that. So she and I sat down on a beautiful Sunday afternoon and talked about that and a whole host of other things. So let's get to the interview. Here is Jess Mulvey. Jess Mulvey, welcome to Buds with Suds.
Happy to be here.
I still kind of giggle when I listen to that, when I say that name, just because I've gotten a lot of comments on it. Actually, if anyone's interested out there, I did get an email from William White, from Bill White, who, seriously, he's listening to the show and he likes it.
Oh my goodness!
So that's just to make you a little more nervous than you already are. I hope that didn't get you. So you and I had the pleasure of meeting at North Shore Community College, right? You were in a class with Michelle Simons, who
Simmons.
Simons.
No, I've been calling her the wrong name.
I did too, and I did it during the podcast, and she corrected me on the podcast. So Michelle Simons was on the show, and she had asked me to come talk to your class, which I did, and we met briefly, and then you sent me an email with a document that we will get to later. But right now, I kind of want to hear about what you're doing. You're a recovery coach, right?
I am a case manager and recovery coach at Lynn Community Health Center, working with complex patients.
What does that mean?
It means they have more than one diagnosis, most of them medical and behavioral or substance use disorder. We have a caseload right now of over 650.
Wow. So medical, like what?
It can be anything. It can be paralysis. It can be missing a limb. It can be diabetes. It really depends. If you qualify for Medicare A and B and Mass Health Standard or Common Health, then you qualify for my department.
And your department is what?
So we are very unique, actually. I work technically with an insurance, but we're an insurance that does case management, social work, and we're a team of community health workers that do managed care. We do assessments. We authorize services in-home, adult foster care day programs. We provide transportation to all medical appointments without PT-1 forms. We also can provide social transportation. I think that that's a big thing that's lacking in the healthcare industry right now is the social aspect of a lot of diseases. So we have the ability to work on those type of issues and make sure that the patient is meeting their social goals as well as their medical goals and behavioral health goals.
So what exactly do social goals mean?
A lot of patients with complex healthcare needs and behavioral health needs normally have some sort of financial issues or housing issues, food or dietary issues, social anxiety, or something that prevents them from achieving a healthy social life, whether that be lack of transportation or, again, lack of funds. So we take the approach that all levels of a healthy life really need to be focused on in order for a patient's overall health to improve, which is why we do authorize like social services and day programs. So not just like substance use or mental health programs, but just like the GLIS Day program, so that people can have social interaction. They're not isolated. They don't feel lonely. They have that constant support.
So But is your kind of own specialty around substance use, or
Mine personally on the team? I do recovery coaching, and I also do all the enrollments, re-enrollments. I help patients with housing issues. I help patients that need help with their DTA or things like that. Our team is like multi-focused, and they use the term complex care because there is no real good one term for it. All of our patients are different. No one patient has the same diagnosis. So our team's focus, it's very unique because we're the only people in the health center that are actually in insurance. So it was kind of a pet project that the state took on, and it's now in 14 different states. So
what do you back up just a little bit? What do you mean by that?
So our branch of insurance, and I'm trying really hard not to mention the name just because I didn't get authorization to do so.
Sure.
It was a state-funded program for people on Mass Health and Medicare to combine the two insurances together. By doing that, we were able to kind of fill some of the gaps that Mass Health had and Medicare had, whether that be copays for insurance. We also authorize better dental service, things like that.
So you guys have your own health plan for your patients?
Exactly.
Okay.
And on top of that, we also manage their care. We meet with them one-on-one. We help them do their paperwork. We check in with them after any hospital visit to make sure that they have all the services they need at home. We meet the patients at the home or in the office, whatever they prefer, and try and invest again in their overall health, because we've found that if you invest in everything at the beginning, provide the services, provide the social support, provide the financial support, overall, like emergency room visits go down, inpatient visits go down, and health stabilizes.
Right, which is interesting because Partners is kind of working the recovery coaches in the same way.
Yeah.
It's not an insurance paid system, right? So the recovery coaches are paid by the primary care facility. And the way that the viability of the recovery coaches is shown is by exactly what you were saying, right? More PCP visits, less emergency room visits, right? Therapy visits, which the PCP and the therapy are all billed back to the insurance companies, so that eventually, when all those numbers start making sense, it pays for itself.
Yeah,
right?
Exactly.
So,
we kind of touched base on that a little bit when I met you, that it was kind of similar. We don't just do recovery, though. It's everything.
So kind of sounds like socialism to me.
I'm okay with that.
Yeah, I know. Me too. So you're getting them. They're coming in basically for other diagnoses, and the substance use is kind of a secondary or tertiary diagnosis, and then you're getting called for that.
And normally, the position of recovery coach is really new to the health center, so we're kind of still figuring it out. I'm blazing the way a little bit. But essentially, most of my patients right now have come and been referred to me by their care partner, which is the person that manages their care, because they're having some sort of crisis, whether that be a relapse or a housing issue. And they also have substance use disorder. And then I take it from there. I have some patients that I've helped get into crisis stabilization units until they figured out their housing. They've had very brief relapses, and they really just need a little extra support. I've had some patients that are already placed in either a sober home or a halfway house, and they are just looking for a little more understanding on the team. They're looking to understand their options. If they don't like their sober home or halfway house, what other options are out there? And then I have some patients that were on a clinic, and for whatever reason, they're no longer welcome at that clinic. They need help finding other services, or they're just homeless in general, and they really need a soft place to land. So normally right now, that's how I'm getting my patients. I'm hoping that will change, that I'll be able to work a little more consistently. But again, this is a very new thing for the health center. So
work a little more consistently with substance use disorders.
Exactly.
Right.
And have a little more long-term support for the patients, because right now I'm kind of just a bridge in like emergent settings.
Okay.
So I do hope the focus changes, but we're just trying everything out right now and kind of going step by step.
So, right. So to go back to my brief introduction of you, the class that you were in was, I think, the first half of the recovery coach program for the CARC, right? For the CARC.
Technically, it's the second half. I was signed up for the first half.
Oh,
That's
okay.
supposed to start in January, but there was a problem with registration. There wasn't enough people registered, so they canceled the first class, but the college said that we could take the second class first, and then I'm taking the last 4 classes in 2 weeks. We have 2 weeks off, and then we go back.
The last 4 classes of the second half.
The first half, but yes.
Oh, okay. All right. Yeah. Because what's funny, I talked to Dennis about this, Dennis Doris, on a previous episode, and where before North Shore, I did my second half at North Shore Community College with Steve Chisholm, and the first half of it was a nightmare. I mean, you had to drive all over Massachusetts for all these different classes and stuff, and they weren't always offered. And there was one coming up, and it was like 3 months down the road, and it was out in Springfield or down in the Cape or in Plymouth or something. And then the next one was maybe in Peabody, but they weren't quite sure, which is closer to me because I live in Salem. And then the next thing you'd be waiting for this class in Peabody, and the next thing that happened was, we didn't have enough people enroll, and so we're putting it out in Western Mass, and it's going to be a 3-hour drive. It's almost in New York, for God's sakes. And that's the kind of stuff that we were going through. So when North Shore Community opened up the first and the second parts of those classes, that was awesome, because now you can go in for 4 days, right? I think it's like $500 or something.
Yep.
Right, and get them all, because you're there all day for 4 days. It's 4 days, right?
Yeah. Yep. And it's a complete day's class, 8 hours. And I, too, had the same frustrations when I was researching the class. When there was beginning talks of this position, I researched how to become a recovery coach, what that entailed, what classes I needed to take, how to get my hours signed off.
Right.
And I even had trouble just finding the information. I at first found, I think AdCare does some classes, and I experienced the same thing where they wanted us to go to Lowell, and then the next class was to be determined.
Yeah.
And you have to submit an application. It has to get approved. You don't know when it's going to be approved. So my mother actually found the class on Facebook. A sponsored ad came up, and she
no kidding.
took a picture of it, and I was enrolled, I want to say, within 48 hours.
Yeah.
So thank God for North Shore Community College. And the class they offer is super comprehensive and just a really comfortable space to learn in. So
Yeah,
I've been very
Michelle
impressed.
does a really good job.
Mind-blowing.
Yeah, she's very good. Yeah, and I think what you had mentioned earlier too, with where you work, and I don't think this is I don't think we're throwing anyone under the bus, because this seems to happen to quite a few organizations who have hired recovery coaches, is that they know they need one, they just don't know what that means. Almost everyone I talk to, it's the same issue. It's, they hired a recovery coach, but they don't really understand what that means. And then they're, I think was it TASCOM or TRANSCOM and BSAS both put out definitions of the recovery coaching model. And of course, William White has written a lot about the recovery coaching model, at least since the 90s, if not earlier. And, everyone just seems to be winging it. Right. So a lot of times, and I think that was the class you were in, there was a woman who was asking, well, how do I interview for this job? First of all, I was a little taken aback, because she seemed old enough to have been on some interviews. But the good part about this is that no one really has defined this job. So if you are interviewing for a job, you have the opportunity to kind of define it and then tell them how you fit the job role that you just defined. Right. And that was one of the advantages personally that I had. Not so much that I defined the job, but it was brand new, right? And I happened to work with someone and for someone who is exceptional at going, okay, yeah, sure, let's try that. And so it's been a great little road here so far. You had mentioned housing, and the document that I alluded to earlier was this monstrosity that you sent me. I was actually pretty impressed. You took the initiative to reach out to me and send me this document that you had. You have how many pages is it?
Oh, gee, I don't know how many rooming houses, but I can tell you that there is 85 long-term residential programs on there.
Yeah, so it's quite a few pages. It was also an Excel spreadsheet attached to it, which was comprised of
those were the 85 recovery homes, halfway houses, that I kind of was handed like a basic list with some contact information that my job started to contract with. And I looked at this list, and my idea of recovery coach in my head is that I'm going to be guiding people through early recovery and helping them pick the path that's right for them. So I volunteered to my boss to start researching these recovery homes, these halfway houses, see what the differences were, what type of patients they accept, what type of patients they don't accept, who's the best person to contact, which is the best website to look up to find the information you need, because not all of them have like actual websites, and even some of those websites aren't very good. There are better websites to, research what you need to know. So I spent the better part of a month emailing.
That's it?
Probably more at this point. But when I sent you the document, I had emailed every single program on that list. Some of the emails were bad. I just got bounced back, about 12, which I have a list of bad emails, so I can send you that. About half of them got back to me. Half of them did not. Some people have called me. So I continued my research on the World Wide Web while I was spending my mornings on hold with Mass Health or trying to help my patients in some way. And I started having conversations with the directors of these programs. Hey, can you send me like welcome manuals, what your patients get when they get there? Can you tell me what a day is like there? Are you close to places where these patients can work? Do you accept people with mobility issues? A whole bunch of questions in my mind came up that just the website wouldn't answer. So I was actually speaking via email with an amazing woman named Michelle. She works with Gamma out in Gardner, and she was the first person to actually offer me a walkthrough of their programs out there. So I got the brilliant idea that I was going to bother these programs until every single one of them let me come check it out. I did that for my own ethical reasons, mainly being I want to feel confident that I'm making the correct suggestion for who I'm working with, and I think the best way to do that is to physically go and look and tell them what these programs can offer. So I started doing walkthroughs. I've walked through about 7 or 8 of them now. I have many more scheduled.
Do you?
I do. And it's just been a really mind-blowing experience, the versatility and difference in these programs. They all kind of look the same on paper, but they're not. They're not at all. Some of them, in my opinion, are doing it like knocking it out of the park, and they should be the standard of care in the state. Some of them are reaching bare minimums. Some of them fall somewhere in between, and some of them I haven't seen yet, so more to be revealed.
So what in your assessment or opinion would be, I don't need the name of a particular house, but what in your opinion would be a bare minimum?
A bare minimum, mandatory meetings, both in-house and out-house. Doesn't have are these rooming houses, or are these all sober houses? The ones I'm doing walkthrough are all long-term recovery programs.
Okay.
Yeah.
Okay. Interesting, because I think the list said rooming house, right? It was a rooming house list.
There's rooming houses on there as well, and actually some of these programs are recovery-based rooming houses as well. Not sober houses, but SROs that have their own buildings just full of apartments, full of people in recovery.
So can you define the difference between a sober house and a, did you say SRO? Or?
Yeah. So a sober house...
what does SRO stand for?
I have no idea.
Okay.
A single rooming option, actually.
Okay.
You're putting me on the spot now.
That's okay.
So the SROs, at least that I've seen, are essentially studio apartments run by a nonprofit. All of the ones that I've seen have some funding from DPH. The rent is lower, reasonable, in my opinion. They have a standard of care in regards to how often they meet with a case manager from their program, how they set up care plans and goals, how they're going to work their recovery, whether that be AA or NA meetings or SMART recovery, whatever works for them. what their long-term goals are, where they're going to go, for the next step. Most of them are 2 years long, single room options, just to prepare them for life without the safety net. Sober houses are a group of people renting like an apartment or a house, or an independently owned house that is rented out. You normally share rooms. There's a house manager there. In SROs, there's not a house manager, but you still do work with a case manager. You still have urines and things like that, and sober houses tend to have that too. I haven't seen all sober houses in the area, but most of them do.
So the SROs are basically like, I mean, you already said this, but it's independent living, all right? You have a case manager. You have random urines, right? You're expected to go to meetings or groups and things like that.
They call it meaningful day activities.
Okay, and then you basically go about your day.
Yep.
Right, you have your own little life.
You work. You can have people over. If DCF is involved, which happens to tons of people with substance use disorder, you can have your kids come for overnights there. It's a safe place. They really allow you to be independent. So,
do you personally think that that's a good option?
I think it's a good option to work for. I think it's a great step up for somebody who's graduated a halfway house, but isn't quite looking for a sober house. Sober houses are not for everybody. This is a little less chaotic, a little less people than a sober house. But they're just not financially or emotionally ready to rent their own apartment or house. I was amazed that these options even exist. I haven't found any in Lynn or the North Shore yet.
I'm amazed myself.
It was.
I mean, I think that sounds really cool.
Doing the walkthroughs and this one program, which I have to name drop them because they were phenomenal. It was Gamma in Gardner, and they have some in Athol too. They also own a private pay farm that people can go to get sober there, which was also incredible and beautiful and comprehensive. But these SROs, they bought this building that needed to be rehabbed, and I mean when I say rehab, this place is better than my own home. They did all the work like in-house, and they hire people that are graduates of their programs to help with these places. A lot of the furniture there on the farm, they woodwork. They teach woodworking at the farm. So a lot of these places have furniture built at their farm, and it's unique and beautiful. It's well thought out. And they just have an all-inclusive and what is the word? Comprehensive, really. They take the approach of halfway houses that my team takes the approach of healthcare. Some of their houses had support animals, which was just amazing to me. Some of the houses had built-in AA halls in their basements where they ran AWOLs out of and they held commitments in, which is something that I hadn't seen. A lot of programs have these, meetings in their living room, and they have people come and talk to them, or they use a building across the street. But this was a dedicated AA hall in their basement. I was like, wow. They had a gym in there. One of the houses, they built an elevator in there and made every floor handicap accessible so that people with mobility issues could transition into single and double room options. A lot of these programs, you start off with a multiple room when you first enter the program, 3-4 men or women, and you reach certain steps and accomplish certain goals, and you get the privilege of moving into a smaller room, 2-man or 1-man. And they installed an elevator so that, again, people with mobility issues could transition through the program just like everybody else. All the bathrooms there were handicap accessible. I've been in 2 halfway houses myself, and they certainly didn't have that. I was just totally floored that they took into account like every aspect. They also had a chef, one of their residents there. And this is not a private pay program.
I might have to start drinking again.
This is not a private pay program. This is like a DPH funded,
no kidding,
insurance covered program, and they happen to have a chef there, and that's it. Like, he cooks for everybody. That's his job of the house.
Do they have a minimum requirement of recovery?
It depends. They have several different houses. So the information is on the sheet. I don't know it off the top of my head, but on that Excel sheet, it does tell you what they accept. Their website is also very comprehensive. They don't do obviously detoxes in the halfway house, but it's not like it's not like a set of like you need 3 months to come here. Everybody's at a different like level. So I think it really depends on where you are mentally, emotionally, if you're on medication, if you're medically stable, for them to accept you. But they were really open to receiving any referrals.
How do they feel about medication?
They certainly approve of MAT and accept patients on MAT.
Okay. And what about other kinds of medications like psychotropics or?
Oh, yeah. As long as you're medically stable, psychologically stable, they'll accept you on medication.
Okay. And so, and again, you don't need to mention names, but were there any ones that stood out as being horrible and why? Like I said, we don't need to mention any names, but
a lot of the programs were,
like let me put it this way: are there some on your list that you would look at and go, I would never send someone there?
Yep.
No matter what.
Well, as a recovery coach, I can't say that. But personally, if they were asking for my honest opinion, absolutely, I would say no. I don't think it's right for you to go there.
And why? What did you see with some of those?
So some of them, there was one that just refused to take people with mental health issues, and particularly named schizophrenia, even if it was managed. I thought that was just really weird to me because a lot of people with substance use disorder also have accompanying mental health issues.
Well, a lot of people manage their mental health issues with substances.
Exactly. So that was mind blowing to me that they just you cannot, if you have a mental health diagnosis, you can't come here. So that kind of turned me off a little bit to that program. There are some sober houses in Lynn that I just know personally are poorly managed and poorly financially managed. There are reports that mandatory urines are not being done. So those programs I would really strongly deter people from going to. I would definitely say if you're looking at a program to research it, try and reach out to graduates of the program if possible. Most programs that I've encountered do have a list of graduates that would be willing to talk to you.
That they'll supply you with.
Yeah. And in particular, the Gamma House actually have most of their people that are on staff there working as counselors or, the facility people are graduates of the program. So you can ask right there. But I know the program that I graduated from, which was the Shepherd House in Dorchester, which is not an easy program to graduate from because they are behavior-based. They don't use urines. So you're really accountable for your own recovery there. There is not a safety net. I feel like a lot of people kind of need that mandatory urine to prove to other people and themselves that they are clean. I didn't need that, but a lot of people do. They have graduates that are always welcome back, no matter what, constantly doing house meetings there, coming and doing commitments for house meetings there. So if you ever reached out to the director, she could absolutely give you testimonial and people to back up like what a life of a graduate is. Some of these programs were on the exact opposite end of the spectrum. I emailed one. I had a patient that was in a sober house and looking for a different sober house. And she asked me, to email some people, check some things out for her. And I did. And one of the programs emailed me back and said, have them talk to me directly. They would not talk to me at all, even after I explained I was a recovery coach and I'm going to be referring people. So that kind of turned me off, just the complete disconnect to somebody that is trying to help multiple people in recovery find places to go.
Yeah, you would think that you'd want to go, oh, wow. Yeah, that could be a pipeline.
Yeah, I was so surprised. She absolutely would not talk to me at all. So I kept it moving. I don't think I'll be doing a walkthrough there. Some places just didn't even get back to me. So they're going to be hearing from me again real soon. And then some kind of gave you the impression that they wanted to deter you from referring people. Oh, our wait lists are always at least 4 weeks long, so they have to find somewhere else to stay until they can get in here, things like that. But didn't provide any solutions to that or bridges to that. I got the impression that, especially in the inner city like Boston, some of the people I spoke to there really were overwhelmed with the amount of patients that they had. It was hard for them to keep up with. And, they were willing to give me the information, but, very hesitant to be like, and call me if you ever have anybody that's in that situation and we can try and help you. So that was surprising as well. I shared with a lot of these programs that, I was a graduate of a program, that I have 6 years sober. Some of them didn't address that at all. Some of them, it made them connect with me even more. So I held those programs in a lot higher regard, that they were invested in learning more from somebody that was in long-term recovery and that went through the process. But it was definitely a mixed bag, and not one program has been the same yet.
So what was your process like?
So a little history about me. Before I worked at the health center, I came from customer service and nonprofit fundraising. I actually met my husband in the 2012 elections doing door-to-door canvassing. So I am no stranger at just picking up the phone and cold calling.
Canvassing for who?
I am a proud Elizabeth Warren, Barack Obama supporter. We also helped get Marty Walsh into office. And cool story about him, I met him when I was 4 months sober and canvassing with my husband. And he gave me his prayer beads when I told him I was 4 months sober. He said, they kept me sober for 24 years, and I hope that they keep you sober as well.
No kidding.
And I have them. I carry them every day. So they're
What
beautiful.
are they mala beads, or are they actual, like...
They're true rosaries. They're wooden
No kidding.
rosaries.
Oh, no kidding.
I carry them every day. So if Marty Walsh, you ever hear this, you stuck with me, I'd support you in any election ever.
I don't really like how he feels about the safe injection sites and stuff, but
I don't have to like everything about a person, but
Yeah,
he is a
no,
wonderful human being.
Overall, my opinion of Marty Walsh is pretty positive.
He was very open with me when I told him I was in early recovery. I was really amazed that he invested in me like that. He took the time to listen. He was doing like a press conference in Charlestown, and they just pulled us off the street and said, "Hey, you're canvassing for Marty. Come meet him."
That's really cool.
Yeah, so he was amazing, and I was honored to be a part of it.
So you've done door knocks and cold calls and all kinds of stuff.
I've been chased off of people's lawn. I've been bit
kidding.
by dogs. Yeah.
Yeah. Wow. Okay. So continue, please.
So essentially, it was like cold calling. It was just, here's this list of programs, and have fun. So I just started sending emails to people that didn't respond to my emails. I started just calling and asking for the director and leaving messages. And I started researching their websites to see if they had different contact information than I had, and tried those numbers. I've got a lot of wrong numbers, or, oh, he's not in this position anymore, let me get you to the person that is, type of situation. But it really was very much similar to outreach, just reaching out to people you've never talked to before and saying, hey, I need help. The overall response has been pretty positive. Despite those negative, kind of push you away, I don't really want your referrals, or don't talk to me. The vast majority were at least open to sending me material, and letting me come walk through. So I've been very blessed in that aspect, that people have opened their doors for me.
So in 2012, you were canvassing, right? And when did you get into recovery work?
Essentially when I got sober. So my dad, who passed away last January.
I'm sorry.
It sucks, but it's the world's loss. I still carry him.
I lost mine 2 years ago, so.
I carry him in my heart every day, and he was the propellant for me to change my career, because I was very good at fundraising. I worked for NPR and WGBH. I was the assistant canvassing manager there. So it was a very good career for me. But my father was also a recovering alcoholic and addict, and he died sober. 2 years before his death, he fell off a roof, he broke his neck, he became a quadriplegic. And that man still hosted meetings in his house,
wow.
Still sponsored people. The night that we found out he was dying, he sent me to his home group to, talk to people and let people know, don't fear for him. He's not in pain.
How long was he sober?
Almost 9 years.
Wow.
He was a true blessing to the recovery community, specifically in the Metro West. He was from Marlboro. We were very, very, very blessed and honored. The Recovery Connection in Marlboro actually let us hold his memorial meeting there. We had, rather than like a funeral, we did have a wake, but rather than a funeral, we decided to do a meeting in honor of my dad and let people speak about how he affected their recovery. And it was beautiful. So Kelly over at the Recovery Connection in Marlboro, we appreciate you every day. So he always pushed me after I got my first year sober to focus more on using my story to help other people. And he also wanted to work in some capacity with people in recovery, more than just sponsorship and what he was doing. But he never got the opportunity to because of the accident. Mm-hmm. So on his deathbed, he made me promise to push myself in my personal recovery and take it to a different level. He knew that I wanted to work helping people. I didn't know what that meant. And very, very soon after my dad died, an ad came up on Indeed for the health center. And I was not qualified. I didn't have the experience they wanted. But I took a chance and sent them my resume anyway. My aunt did not believe it when I got the call for an interview. And in my interview, I told my boss, why I'm here. I'm sober. I miss my dad. My dad wanted me to do this. It really fueled me to take the step and step out of my box of fear and step out of my wheelhouse of what I had been doing for the last half of a decade. And they liked me, and it worked. And here I am a year later.
It's a pretty compelling argument. So your dad was 3 years sober when you got sober. Mm-hmm. Is that right?
He probably a little more than that. Yeah. Probably about 3.5 years sober. And I got sober, and I got sober because of my family, because they set boundaries and they let me hit rock bottom. I ended up getting arrested, which is a story that most of us have, or a lot of us. So I'm not ashamed of that either.
Who hasn't? There's no shame in that.
But my parents really were smart in setting the boundaries and loving me, but not to death. They always welcomed me with open arms to take me to a meeting, but they never tolerated my bull. They never let me make excuses for myself.
Was your mom in recovery too?
My stepmom is.
Okay, your stepmom, yeah.
Yep, she's been my stepmom since I was born. So she's still alive and still sober and still out there doing her thing and saving lives today. Love you, Mom. She's going to be listening to this.
Putting a lot of plugs in here.
Exactly. And, my real mother, who I live with, we're saving for a house. She was always very supportive of my recovery, too, though she's not in recovery herself. She always understood the disease. She always understood the toll it took on families, and she always understood that boundaries needed to be set in order for a person to want to get sober. So once I had about 3 months sobriety, they could start to see a little bit of a difference in my demeanor, my willingness to be honest, my ethics, and they, kind of all put out an olive branch. My dad I met my husband in 2012 and I was still using, and he wanted nothing to do with me. And then we got called back for the Marty Walsh campaign, and I was sober by then. And we've been together ever since. And my dad hadn't wanted to meet a boyfriend of mine, I want to say, since my ex-husband. Fair enough. But he met my husband, and my husband's also not in recovery, but he's never had a drink or a drug in his life. And that man did everything he could to learn about my disease. He went to meetings with me. He lived in a sober house with me and followed all the rules of the program. Wow. He still can tell when I need a meeting, and he'll call me right out on it. So my dad met him.
Sounds like a keeper.
Oh, I hope so, if he'll have me. But my dad met him and, just saw a whole complete difference of, who I was surrounding myself with, what I was doing. And that is when my dad really started investing more in me and kind of had a little bit of hope that this was going to be the time that stuck, because this isn't my first time in recovery. And from there, the rest of the family followed suit, except for my grandmother. My grandmother, I hurt her very badly. I stole from her. I treated her horribly, my poor Nana. And my dad had no faith that we'd be able to repair that relationship. But after I gave birth to my first daughter, my first child, Rachel, I wrote a letter to my Nana making amends. and my Nana called me, and I've seen her every weekend since. So I've experienced a lot of miracles in recovery, and
I'll say
my dad really kind of instilled every decision I've ever made in my life has been based on fear. So do not live in fear anymore. So when I applied for this job, I took the fear out of it, the fear of being inadequate and the fear of not getting the job or failing. I listened to my dad in my head, and I threw that fear away, and I said, I'm going to try it anyway.
So do you still you're still involved in meetings, and you're still going to AA and all that kind of stuff?
Yep.
And working in recovery. So this is a question. I mean, I've had this question for myself, and I've also had this question for other people on the show and people I work with and people I come across. Is that I find that this job in particular, and I think I might have said this when I came to visit your class, that when you're working in recovery and in recovery yourself, you're acutely aware of your own crap. Right? You're acutely aware of what your stuff is that you're bringing into the job, right? So how do you manage that?
So that's been a big question. That's kind of a work in progress. We professionally, I think we need a little more support. And I know Michelle told me that she's considering, or maybe has decided to start a support class.
Yeah, she and I have talked about that.
Yeah. So I'm interested in that. I actually presented that to my boss, and she said that we could do it on lunch sometimes if we wanted to, but the health center wasn't going to run it, but that's okay. But what I do now is, I use my tools that I've always had, that I've always, been taught for self-care. I actually, when you texted me yesterday, I told you I was going to take a nap in the name of self-care, because I have 2 children. We also live with a foster baby in my house who's turning 1. So 1, 2, and 4. Sleep is few and far between. So I'm not afraid to take a nap today. Music is a really big outlet for me. Pearl Jam is me and my husband's soul band. So we try and see them every time they come around. I am a big card player. It's something that connects me to my dad and kind of lets me let go of what's going on in my life. I think the bottom line of it all is to try and focus on doing things that take me completely away from recovery. I feel like recovery can't be my whole life. I feel like recovery is number 1 in my life, because if I'm not sober, if I'm not actively working towards bettering myself, I'm not going to be a good mother. I'm not going to be a good employee. Actually, my Facebook says I'm sober first, a mother second, a wife third. And that's it every day, because I wouldn't be anything else if I wasn't sober, but it can't be the soul of my existence. So I try and make weekend activities. We like going to the park or out for ice cream with my kids, or watching a scary movie with my husband on a Saturday night. Things like that, are consistently helping pick me up at the end of a rough week. I also work with my sponsor. I go to extra meetings if I need to. I redo the steps if I have to. That's happened twice. And try and live in 10, 11, and 12, on a daily basis. I talk to my stepmom. I visit my Nana to remind myself of why I'm doing what I'm doing, and to give back to them what they gave to me. So I don't know if that answers.
Yeah, well, it does. I mean, actually, I'd before you came on, I have to admit, it's like I was like rooming houses. Like I don't know what I'm going to talk to her about, and I called Michelle, and one of the things that your professor, and one of the things that she said was that aspect of it, of that work-life balance, is something that you do exceptionally well, right? Well, and I think that particularly for people like us who, one, are in recovery and working in recovery, right? And just the fact that you said that my whole life can't be about recovery, right? That's a very good point. And on the other side of that is, we work in an industry which is primarily clinical and medical, that if they understood this, they wouldn't have brought us into it in the first place.
Yep.
Right? And they look at it like there's I went to a class on supervision, and there was this one, and I've mentioned this on other shows, and there was a guy in the class that kept referring to us as fragile people. And I wanted to hit him with a chair, right? Because that to me is probably one of the larger problems and hurdles that we're going to have to get over, right? Is the clinical and medical staff bringing us in and looking at us like we're fragile and easily triggered, right? That we need extra care. And when people in this industry, in the recovery coach community, start saying things like that, it infuriates me. It's almost like everyone's waiting for us to end up on a clock tower picking off kids in a school children with a sniper rifle, you know? And it's one thing to get upset about it, but the thing is too is that we have to start advocating for ourselves. And I don't think the people that are working in this field that are agreeing, I don't think they're helping us, right? It's because to me, the whole idea of sobriety and recovery was that I reintegrate myself into society and become a productive member of it, right? And the only thing that sets us apart from the rest of society is that we've outed ourselves, right? Because for decades and decades and decades, we've walked among the muggles or the normies or whatever you want to call them, right? We've walked among them and nobody knew that we were in recovery, right? And actually William White does this one segment of a talk where he says, you all know people in recovery. You all, they're your doctor, they're your dentist, they're your lawyer, you work right next to them at work. They just haven't told you they're in recovery. But you all know someone in recovery. What makes us unique is that we've had to out ourselves in a public environment, and part of the reason that we're hired is because we're in recovery. Now we open ourselves up and expose ourselves to the stigma that goes along with that from people who have been doing this for the last 40 years, right? At least ever since the 70s when they started LADACs and degrees for substance use and all of that, right? Which started exactly like this program did. So there's already empirical evidence that this entire program can get completely screwed up at the drop of a hat, and it may even be quicker, right? So that aspect of it is, I think, from my shoes, it falls back on us to prove to them that they're wrong.
I agree.
I was just going to say, would you agree?
I mean, I would. When people in my office like ask me what I do, or if they sit in with a meeting with me and a patient, I think the first time, like I sat down with one of my patients who was in a crisis, and I opened up, and another care partner was in there, and I was like, she was homeless, and she's like, how did I get this way? I was sober for 4 years. I can't believe this happened. And I said, after, a time of sobriety, I relapsed too. And I ended up homeless on Tremont Street, smoking crack and, doing things I'm not proud to admit.
How much time did you have?
A little over a year and 2 months. And I thought that I could try the marijuana maintenance program because that's a really good idea.
Well, apparently not for you.
It didn't work for me.
For some people, it works.
I didn't change enough of my people, places, and things, and I was still hanging out with my ex-husband, who's a story I'll tell you on a different day. A fun story, but a story nonetheless. And I could see on her face when I said that, as soon as those words came out of my mouth, she wasn't really judging me, but she was kind of like, "Oh my God. I can't believe she just said that."
Right. What do we have here? Exactly.
And I pulled her aside after, and I was like, I hope that didn't offend you. This is who I am, and this is how I'm going to help this patient. Because I really feel like somebody in recovery knows the best way to help somebody trying to get into recovery. And if they're going to question that, my question to them is going to be, well, what did you do that worked for you to get sober? So I kind of take I'm not going to be afraid of this either. Like, I am going to blaze the pathways, and I am going to set the bar high. I kind of like that a lot of places don't know what they're doing in regards to these positions, and they think they have to kid glove us because it makes it really easy to like exceed their expectations.
To excel.
And it allows me to set a standard of care for myself and for, my employer and for my patients that requires excellence and thoroughness and doing the best you can every day. So I welcome that challenge. I am a crier, and that's okay too. I lived most of my life hiding my emotions.
I've been known to leak a little too.
So me crying doesn't mean I'm weak. It means I'm accepting what I'm feeling, which is better than the alternative. I also love what Michelle says about relapse. It's not the deaths and the crazy, huge circumstances like becoming homeless or losing a limb or whatever you have this idea of in your head that triggers a relapse. So when somebody says to me, I can't believe that you didn't, drink or that you stayed sober when your dad died, I'm like, that's the exact opposite thing my dad would have wanted me to do. Somebody in long-term recovery. It's the tripping on your shoelace or getting a paper cut on a Wednesday at 2 that people in recovery are more likely to drink over. It's not some big event. You mentally relapse far before you take that drink.
Well, the big stuff I completely expect.
Exactly.
Right?
Exactly.
I mean, I expect to get home and my house is burned down.
Yeah.
Right? I mean, that's just part of my thinking. It's the way I'm wired. Right? I heard a guy in a meeting once say that. He said, I was in 3rd grade. This is all about being born with fear. And he said, I was in 3rd grade and I was walking home from school, and if I had gotten home and my entire house been burned down and my family was murdered, I wouldn't have been surprised, right? Because the big stuff doesn't rattle us at all, right? It's the little things. It's the just waking up sometimes, right? And it's being able to manage that, and it's the people that we work with. I don't think it's up to them, right? It's up to us to convince them and to show them that that's not always the case. But with the understanding, and it took me a while to get this, with the understanding that all they see is people like us in the first 6 months to a year, right? Which is miserable, right? It's relapse after relapse after relapse and just mental anguish and everything like that. Your bubble and my bubble is very different from that. We're in a room with 100 people that are 10, 20, 30, 40, 50 years sober, right? And have good lives. So it's really kind of taking that other perspective and being able to show the people that we work with, particularly clinicians and in the medical field, who just see this as being hopeless and helpless, and we just keep showing up in the ER all the time and saying, actually, I showed up in the ER, right? And that's exactly what happened to me 12 years ago. I showed up in the ER. The next morning, my esophagus ruptured. I was in ICU. I had a 2% chance of living, and the doctor looked at my family and said, you know what? This isn't the end of it, because I see people with the same thing come back again and again and again. Thankfully for me, I didn't have to do it again, right? But I could have died on the table that night. And a lot of people do, right? So it is telling our story. It is exposing ourselves. It is opening up ourselves. And in some cases, it's opening ourselves up to judgment and to stigma and to humiliation, and sometimes to ridicule and disrespect. And I think that's, people look at what we do sometimes, I'm not saying everyone, but people look at what we do and say, wow, that's got to be really hard. I'm like, dealing with alcoholics and addicts all day, that's not really hard. Dealing with the rest of you is what makes it hard, right? But again, I don't think that it's up to them to change. It's up to us to show them that they need to change. It's up to us to address the stigma, right? To put a more positive light on what recovery is about. And this attitude from people in the recovery community that we're fragile and easily triggered, and we could go off at any moment if something, nasty is said to us, I think is really unfair to those of us who are working in this field.
My dad always told me that what other people think of me is none of my business. And I take that approach every day. I don't just think that it's them putting the kid gloves on. I think it's them expecting that judgment is going to matter to me. And it doesn't. And I think that that's what sets the standard for me, is not letting myself get dragged in what they're thinking and how they're going to treat me to just continue to live. I think that's the best way to change the way people look at us, is to just continue doing what you're doing. Education and watching somebody walk down this road and live this life, to see that it's not what they think. That if I didn't tell them, if I didn't open up to them that I was an alcoholic and an addict, they would have never known, you know? So they, you know, I don't let that bother me. I don't let that be a focus in my life. I don't let that be a focus in my profession. I tell people that because I do want to surprise them a little bit. I do want them to be like, oh, I thought she was going to be a mess or chaotic. And, you know, I thought we really, really had to dumb this down for her. And I love it when and you can see it. You can see it every time you exceed their expectations. You can see that.
And the bar is set pretty low. That's a very adult and, dare I say, sober attitude you have there too. Yeah. And on that note, when I was talking to Michelle, I asked her, I said, do you have any questions you'd like me to ask Jess when she's on? And her question was, because she likes to take a lot of naps, she said, how do you stay motivated?
Oh, that's such a loaded question.
Isn't it?
I think the line of work helps me. Same as in meetings, the most important person in the room is the newcomer. It helps remind you that, you know, where, but for the grace of God, there goes I, where I could be. But, you know, on a selfish and kind of cliche note, I look at my kids every day. They know, well, at least my 4-year-old knows I'm in recovery. They've never seen me drink. They've never seen me high. They have no idea, never had to experience me as I was then. So I don't make a commitment to not ever let them see that, but I do make a commitment every day to not let them see that. They're not going to see that from me today. Talk to me tomorrow. I don't know. It could be a bad day. My shoelace could break, as Michelle would say. But the truth of the matter is the people that I love, you know, my Nana, who pep talked me on the way over here in the car, you know, people like that, knowing that I matter, having that self-esteem that I did not have 6 years ago, that I'm a person of value and dignity, knowing that I've helped people and that my intentions are pure. All of those things, little by little, depending on what's going on in my day, keeps me focused on the end goal, which is to make it through the day without a drink or a drug, and to help somebody else do that as well. That's
excellent. You know, it's funny because listening to you, I had a lot of similar things happen in my life. I had 9 good years with my dad sober. He died when I was almost 10 years sober. We went bike riding a lot. We played tennis together. I have a relationship with my mother today. She and I were at war for almost 20 or 30 years. I reconnected with my daughter, who I hadn't seen or spoken to in 12 years. And I have friends, and I have people that I can count on, and I can be counted on. And you're saying a lot of the same things. And that to me is not only what keeps me motivated, but when I see people, and everyone seems to think that our job is so hard because we're dealing with people in addiction and alcoholism and mental illness, basically. And I look at people like that and I go, it can only get better. You know?
Oh,
so, I mean, so you
only up from here.
You just have, I mean, you know, you were talking about crying easily, and I'm kind of just choking up myself right now. So I'm gonna stop on that note. I do like to ask one question. Is there anything that you wish I had asked you that I didn't?
No, I kind of came into this with no expectations, but a lot of nerves, and you made it really easy to open up. And I just hope I did your show well, because you're doing amazing things here. So
this was excellent. I want to thank you for coming out on a Sunday afternoon and taking time away from your family to come on the show.
It was an honor and a privilege, and that's my story, and I'm sticking to it.
Thank you very much.